We're going live. Good evening, everyone. Thank you for joining us today. We are very happy to have you with us. And my name is Dr. Michelle Gamble, and this is our monthly Doctors Are In virtual clinic where we invite you, the community, to join us with any questions that you have pertaining to health and wellness so that we may serve you by addressing what your concerns are at the given point in time. So today, what we are going to do is we're actually going to start off with a testimonial from Courtney Epps, who's going to share with us her tragic experience that occurred and the implications that it may have for many people in our community. Courtney?
Hey guys, I thank you for having me on. I just actually I'm driving back home from Conway, which is 4 hours away, getting my mom's death certificate and realizing that, so just give you a background of my story. My mom was murdered in a Conway Medical Center in Conway, South Carolina on August the 7th due to COVID protocol. And, like so many other people, I thought COVID was really bad and really serious. And I'm not saying that there aren't people that deal with it, but most of the deaths that are being caused right now are due to protocol and not due to COVID. And so my mom went in on a Friday and they told my dad she just needs to stay for a couple of days. She has COVID pneumonia and she needs some oxygen, and we're going to give her an antibiotic, which I'm smart enough to know that you don't give antibiotics for respiratory viruses. And so, but my dad did not. And so, left her. And then that was Friday. On Tuesday, my mom was sitting up. She seemed to be doing good. Her oxygen level had increased. And Wednesday morning, we got a text message, or my dad did, from my mom saying, it won't be long now. I love you. Vent-ICU. Do you want them to resuscitate? And then within 30 minutes, my mom, we got a call that she had coded. An hour later, she coded again. They punctured her lung. And by the time I got to my mom, she was completely swollen from the air. They said she would die from her punctured lung. 24 hours later, we got a phone call from the doctor saying her lung had miraculously healed and that her lung was great, but her kidneys were failing. The next day, her kidneys were failing. The next day, which is a Saturday, so my mom was in there for 8 days.
You're breaking up on us, Courtney.
I'm sorry. Can you hear me now?
Yes, we can.
Hold on just a second. Okay. And I can pull over as soon as I get to an exit. But what they said is that my mom's blood pressure was too low to give her dialysis because her kidneys were failing. And my mom had high blood pressure for 25 years. And so it didn't make any sense to me. She had no kidney problems. And, the only thing I knew that COVID was killing people because of the ventilator. And so that led me on this rabbit chase to post that my mom didn't die of COVID. My mom died of a COVID protocol. My dad pulled the plug based upon what they told him. He pulled the plug. And, I've got my mom's death certificate here beside me, and it said my mom died of hypertension. Was told that she would die and her blood pressure would be so low that she couldn't have dialysis. So they wouldn't do dialysis on my mother. And so, I share that with everyone, and my mom ended up dying from remdesivir poisoning. I've done the research now, and Dr. Brian Artis has done an amazing job of sharing this all over the country now. And we're starting to see hundreds and thousands of people who are coming out and telling this story of what Remdesivir does. And they knew it. Fauci knew it. He owns the patent to Remdesivir. The studies that have come out has proven that it kills. The Remdesivir study with Ebola killed 54% of every person who took it. And they pulled the study, they pulled the Remdesivir. And then there was another study that was done last year, and it was proven that 22% of every person who took Remdesivir would die of septic shock, organ failure, multiple organ failure. Then they would get kidney failure and then hypotension. And that's exactly what happened to my mom. And, you know, so just sharing the story of what happened. And I'm literally getting 20 to 30 people a day reaching out to me, begging for help, not knowing what to do. And these hospitals are killing people. So we have to focus on what, you know, Dr. Michelle is doing, focus on making sure that we have the immune support and that we are healthy and stay out of the hospital. So please don't go to the hospital. And I will tell you this, I just have to share this, Dr. Michelle. The same day that when my mom died, I posted a video and it went viral. I mean, tons of people, a drug rep sent it to a lady. I know her, and her mom was in the hospital, same hospital as my mom. She'd been on a ventilator for 2 months. Every day they told her she needed to pull the plug, that her mom was a vegetable. She had a massive stroke and she was not going to make it. And I sent her a video, a prayer, a coronavirus prayer. And I said, say this prayer. And then I called her, and within 60 seconds, her mom woke up. And I hadn't heard from her mom to find out the status in over a month. I figured she was still on the vent. And, you know, I checked on her today, and her mother is perfectly fine. After she was told that her mother was a vegetable and that she was going to die, her mother is perfectly fine. She never really had a stroke. They were just trying to talk her into pulling the plug on her mom, because they told her over 30 times to pull the plug. So I just share that, you know, I can't bring my mom back, but I sure can help other people know what's going on, and don't buy into the hospitals, because they're not there to keep you safe. They're there to kill you at this point.
Thank you so much, Courtney, for sharing with us your story. And I know I speak for everyone when we say that we are deeply saddened for your loss. And we pray that God's love and protection will continue to be with you in this challenging time.
Thank you.
So, ladies and gents, one of the reasons why I asked Courtney to share her story with us is because, as we have always said, an ounce of prevention. You know, I cannot impress upon you enough the importance of seeking to prevent an escalation in the symptomology of any disease pattern, and that includes COVID-19. One of the resources that I encourage everyone to look into is an organization and a website called flccc.org, Frontline COVID Care something.org. And that is an organization of several physicians from across the United States and other countries that have come together to provide everyone with access to protocols that you can use before things get escalating to a certain point, and also protocols that you can share with medical professionals if you get to that point where things are extremely dire. Now, a very important fact to share with people is that you have what's called a patient's bill of rights. And a lot of hospitals do not want you to realize this. And there are certain people that I have worked with in the past that when they had family members that were in the hospital, and the hospital said, oh, you have to stay here because of this and that. And I said, just tell them about the patient's bill of rights. Tell them that you know about the patient's bill of rights. And I've had people who have checked out their family members from the hospital to go elsewhere. The reason why I'm saying this is because you have the right to be an advocate for your family members. But the only way that you can be an advocate for your family members is if you have the chutzpah or the badassness to say, look, stop. Either you're going to answer to my questions, or we are going to leave, or we're going to bring other people in. Now, unfortunately, things have gotten to a certain point with Courtney's mother where she didn't have that option. But what I'm sharing with you is before it gets to that point is when you need to have an awareness of what your options are. And that's why it's important for you to go to this website, flccc.org, because they have a protocol that you can do that is outside of the hospital. And then they have a protocol that you can share with medical personnel to do inside of the hospital. As Courtney shared, Remdesivir is one of the worst medications that you could use for COVID. It has the worst outcomes. There are other medications such as ivermectin, budesonide, hydroxychloroquine, all kinds of other things that have much, much better outcomes. But they're not going to use them here in the United States unless you force their hand. And so you have these organizations, including American Frontline Doctors, myfreedoctor.com, flccc.org. These are all different resources with qualified, licensed medical professionals that can give you the prescriptions that you need, as well as access to the medical protocols that you can advocate for yourself and for other people. So, Dr. Huante, what are some thoughts that came to mind?
Well, first of all, Courtney, I'm very sorry for your loss. And also all the losses of all the people who have lost a lot of people or family members. We are in this together. And as a family, as a world, we have to be together, having these kind of thoughts that we can go through this. We can have a healthy lifestyle to be healthy, to keep away from the hospitals, to keep out of these protocols that they have like put in all the hospitals in all the countries. And a lot of us, we don't want to be on that kind of hospitals or with those vaccines or with those kind of treatments. And that's what we are doing here with Dr. Michelle, to see that there are another kind of treatments, that there are healthier ways to come out of this COVID pandemic.
May I ask you, what is the protocol that you utilize in Mexico for COVID patients?
The same as in the US. It's the same that World Health Organization has in all of the members or the countries that are members of it. So it's the same.
So what is that?
They go into the hospital, and if they have like low oxygen, they have Remdesivir and other antibiotics, depending. We don't have a lot of money in all the hospitals, so depending on the hospital, they will give some sort of antibiotics or some sort of treatments. So it depends on the money of each hospital.
So I was curious, why would they use antibiotics for a viral infection?
Yeah, I know, me too. That's the first question I've been having since this started. But yes, they do use antibiotics for the pneumonia, not for the COVID, but the complication on the pneumonia. Mm-hmm. And that's what they're using here.
So, ladies and gents, you have the ability to advocate for a variety of different treatments. But as we have always stressed here, we want to keep you out of the hospital, period. So some of the things to always keep on hand, especially in these times, to help you to boost your immune system are things like vitamin C, vitamin D, quercetin, zinc, okay? So these are things that help you to be able to fortify your immune system. So things like the quercetin help you to, in a way, simulate the similar action that hydroxychloroquine or ivermectin would do, which is to open up the viral cell component and to help to mitigate the influx of the zinc to be able to go into the cell. Because the viral cell is very tough little dude, right? And it's not, the zinc is not able to penetrate without someone opening the pathway for it, so to speak. So that's where things like quercetin come in. And quercetin therefore acts in a similar manner to the hydroxychloroquine or the ivermectin. But remember that these things are, in a way of speaking, at the very, very beginning of the process. When you have an escalation of symptomology, these things don't work as well, obviously, because you have escalated to that point where you've gone beyond, and you're going to therefore need some bigger guns, so to speak. So that is why we are always emphasizing the importance of catching things in the earlier stages. Unfortunately, in many of the American hospitals, when people go in the earlier stages, they're turned away and like, oh, go home and just chill. Generally speaking, most people do fine, instead of being advised as to how to boost their immune system so that they can stay out of the hospital and don't escalate to a point where they have to be admitted. So those are just some things to keep in mind. And what we will do is at the end of this segment, as always, we're going to make a recording and send you the link to the recording. And we're going to put down the various resources, those different websites that I mentioned to you, so that you can do the research for yourself. Go to these websites, especially flccc.org. They have a significant amount of information and the various protocols that can be utilized both in and out of the hospital setting. Okay, so we had another question that came in where someone was asking about the difference between the 3 different types of COVID tests. And I didn't know if you had any insight into that, Dr. Huante, that you wanted to share.
No, I'm sorry, that's not my field.
Okay, well, I did a little bit of research into this, and actually Dr. Sherry Tenpenny does a phenomenal job of talking about the 3 different types of COVID tests, because it's very important for you to know the distinction between them, okay? So you have the first one, which most people know about, which is the PCR test. And the PCR test is a test that looks for viral components. So it does not identify the virus itself. That's the first misunderstanding that people have. They think that, oh, the PCR test will detect the coronavirus. It does not detect the coronavirus, okay? It does detect viral fragments. Now, the problem with the PCR test is that, unfortunately, the PCR test was never, ever, ever, ever designed to be able to be a diagnostic test. The inventor of the PCR test clearly stated, because he's passed away, that it was never to be used as a diagnostic test. And the reason for that is because it cannot distinguish between various sources of the fragment. In fact, the CDC withdrew the emergency use authorization of the PCR test on July 1st, 2021. Because, and this is stating from the CDC, not Michelle Gamble, because it is not able to distinguish the difference between something as simple as the flu versus the coronavirus. So that is one problem with the PCR test. Another problem with the PCR test is that it's a matter of how much you amplify it. So a PCR test is like a magnifying glass or a microscope. And when you look at something under the microscope, depending on how much you amplify your lens, you may see something, you may not see something. If you amplify your lens strongly enough, you'll see everything. It's like, oh my God, there's just crap all around me that you didn't see before because you didn't have it amplified to that level. Now, when it amplifies, when it comes to the PCR test, what they have studied and they realize is that when you start to amplify it beyond what's referred to as a certain number of cycles, then the reliability of the test becomes less and less. And what they have stated is that anything that is amplified beyond 30 cycles, you're going to have just ridiculous amounts of false positives to the point where it's no longer valid. Unfortunately, most of the labs in our country are using PCR tests at cycles that are way beyond 30 cycles. That is what contributes to what we call the case-demic, where you have 50 million cases of coronavirus because the cycles are so high that it's giving a lot of false positives. So anyway, that's the first test, which is the PCR test. The second test is what's called the rapid test. And to go back to the PCR test, with the PCR test, it's usually sent off and you get the results in a couple of days, like 2 to 3 days. Now, the second test is the rapid test. And with the rapid test, you can get the result in as little as 45 minutes to an hour. Right? So anyway, the difference is that the rapid test is testing for the antigens of the coronavirus. And so when the antigens are present, it shows that you have been exposed to the coronavirus within a certain amount of days. I think it's about 7 days, that kind of window. If you have been exposed within the last 3 to 7 days, then your body will show antigens, the presence of antigens. So that's the PCR test. That's the rapid test. And then the third test, which is my favorite test, is the antibody test. Now, the antibody test is just like its name says. It tests for the antibodies, meaning after you have been exposed to the antigens, AKA the coronavirus, the invader, the foreign item, your body creates antibodies. Now, your body creates a different set of antibodies depending on how long it's been since you've been exposed to the virus or the invader. So the first antibody that it creates is what's called IgM, okay? And then after you have been exposed to it and you've kind of getting over it kind of thing, then your body produces what's called your IgG. And those are your long-term antibodies. Those are the ones that you're like, yes, hooray, I now have natural immunity. Come and get me. Any version of coronavirus, I'm good to go. But the IgG doesn't come about until about a week to 14 days after the exposure to the coronavirus. So when you get an antibody test, not only does it tell you whether or not you have been exposed to the coronavirus, but it tells you how long ago you've been exposed to the coronavirus, depending on the levels of the IgM and the IgG. So if you were exposed more recently, like within, say, 3 to 7 days, then you'll see the IgMs. After that amount of time, your IgMs start to decrease and your IgGs start to increase. And those are your long-term antibodies that help to give you what's called immunity, natural immunity. All righty. How did I do, Dr. Huante? Was that okay?
Very good. And even though with the time, IgG may decrease, but don't worry. We have our memory cells in our immunity that even though we don't have a lot of IgG in our bloodstream, we still have our memory cells. That means that when we get in contact with the virus or COVID virus, our memory cells start making again defense to fight the virus. So that's the best part of it, that we have a memory inside our bodies, okay, to fight up any virus or bacteria or parasite or whatever that we have been in touch with, even though we didn't have the symptomatic disease like that, we still make all these immunity cells to fight all these viruses and bacteria.
Isn't it fantastic, you guys, how God is so great in creating natural immunity? And that's the thing that I want to emphasize to you. That's why I said to you that my favorite test is the antibody test, because as Dr. Huante said, you could have been exposed to the coronavirus and you just had a kick butt immune system that went poof, 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 and knocked it out of there, and you developed immunity and didn't even realize it. So what I would like to encourage you to consider is, if you are in that particular pathway, and please note, I am not advocating this, but if you are in the pathway where you say, you know what, I want to get the vaccine, please, 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 at the very least, please, please, please do me this one favor. Before you do that, and like I said, I truly do not wish for you to do that, but it's your choice. But before you do that, please go and get an antibody test, just so that you have peace of mind in knowing that you may have already have developed natural immunity. And in reality, natural immunity, the research is coming in now, natural immunity is more than 10 times better. I believe it's infinitely better than the immunity, so-called immunity coming from the COVID shot. What we're also coming to understand is that the COVID shot, it wanes after a short period of time. After about 5 to 6 months, those antibodies are going down. Now, when we look at antibodies, we also have to put them into another category, which is that you have what's called neutralizing antibodies and you have helper antibodies. Now, the neutralizing antibodies are those kick butt, Marines that go and take care of business, right? The helper antibodies are the ones that are like, oh, you're my friend, come on in, let's chill, let's have a drink together. We're okay. What they're starting to realize with the COVID shot, the one that's created by man, is that over time, the neutralizing antibodies start to decrease and the helper antibodies start to increase. So paradoxically, meaning opposite of what we were expecting, opposite of what we would want, people are becoming more susceptible to the Delta variant and other variants as time goes by, as opposed to people who have natural immunity. The people who have natural immunity, like Dr. Huante says, they have a memory, and their memory is not for just one variant, but for all of the people in the COVID family, in the coronavirus family. So keep that in mind. And then last but not least, and I encourage you to do some research into this for yourself. Another good resource for this is the HighWire. If you go to the highwire.com, you can also go to the childrendefense.org. And the more recent research that is coming out of Israel, some of you may remember that Israel, practically 90 to 95% of their population got vaccinated. And now the ministers in Israel are giving us a warning. They said, look, we are ahead of you guys because we did this vaccination thing months before the United States. And what they're starting to realize is that the people who have the COVID vaccine, not only is their immunity waning, but they are more compromised than people who did not have any kind of vaccination at all. So I'm asking you, do not believe me. Go and do your research for yourself. Do your research and type in Israel, okay? Go to thehighwire.com. And when the beautiful thing about going to thehighwire.com, when you subscribe, they actually give you the links to different research that you can do it yourself. You can go to the CDC website, like I'm talking about. You can go to the CDC website. They provide you with the links to all of these research sources. So these are some things for you to consider, okay? All right, so we have questions. Should we be tested? Well, that's up to you. All that I'm saying is, if you choose to be tested, I personally choose not to be tested, but that's my personal choice because I don't know about you, but I am squeamish about having somebody shove a Q-tip up to my brain. That does not sound pleasurable to me. And at this point in time, I haven't even gone to do some of my blood tests because I don't want to deal with the masking and all that kind of stuff in the labs, you know. So in terms of testing, you can always choose to be tested. I would suggest that you consider doing either the antibody test and or the rapid test if you had a choice, not the PCR test, because the PCR test is extremely unreliable and gives fake false negatives and false positives, and it I don't see any redeeming value for the PCR test. But I'm not a medical personnel. I'm just Michelle Gamble. So, you know, like I said, do your own research and above all, pray on it and whatever you're comfortable with. Like I said, I'm comfortable with not getting tested. I feel that more than likely I have been exposed to COVID because I've been running around doing everything I can to get the doggone exposure so that I can build my natural immunity. So I pray to God that I've been exposed already. And if any of you have had COVID or have it right now, come and give me a hug. And I would love to just get all that wonderful viral exposure from you. Yes, I want to build my immune system. I know you guys may think I'm crazy, but what I do is I fortify my immune system so that I can handle it. And I'm not proposing that anybody else does the things that I do. I'm just sharing with you what I do. But I was also a parent when one kid got the chicken pox. I made sure that all my other kids got exposed to it. So everybody got it and it was over and done with. But at the same time, I was always fortifying the immune system of my children. So for whatever it's worth, you know. All righty, guys, I'm going to open the forum for any other questions. We can talk about anything that is not COVID too. That's completely good. Any other questions? You guys are strangely quiet. No other questions. Oh, come on. Somebody has to have some kind of health question. So everybody's just super healthy, has no issues, no concerns. Everyone in your family is super healthy, no issues, no concerns.
My biggest thing is why are we still getting PCR tests when we have an emergency use authorization taken away? And I asked that to a group of 5 people who were doing free COVID tests today. And I said, what test are y'all doing? Because the PCR test has been removed due to the emergency use authorization. And they literally said, no, it has not. Yes, go to the CDC website and look that stuff up on your own. You are part of killing people, because the problem and how do we combat this is like my mom. I argued this in the hospital about my mom, and how can you prove to me that my mom has COVID when the PCR test has been removed and says that they cannot determine whether you have the flu or whether you have COVID? And I argued that in the hospital, and I was kicked out of the hospital and told if I came back, I would go to. When they're trying, like the logic is every time someone tells me they have COVID, I'm like, how would you even know? Because there is no test to determine whether you have COVID or not. There's a test to determine you had COVID, right? And there's a test to determine whether you have come in contact with someone who has COVID, but there is no test that says Courtney Epps has COVID today. So how do we combat that? So I'm having a hard time with it. I'm having a hard time with people telling me they have COVID when they do not, because they don't know.
It reminds me of the saying, you know, those who say they know don't know, and those who know say they don't know. And the reason why I'm impressing upon people to look into this particular area, and thank you, Courtney, for bringing up that point, is because this is what a lot of the crazy policies in our nation and around the world have been based on, the so-called cases. And as you said, what is a case? What is a case, really and truly? Based on some test that is completely invalid? You know, before the craziness of COVID-19, doctors used to have to go through a significant amount of diagnostic procedures to be able to diagnose somebody as having, say, pneumonia. They didn't just say, oh, you've got pneumonia because you have a runny nose. They had a checklist that they had to go through. They would do an examination, and they would culture the specimen in a petri dish to see, you know, if it replicated and if it was a quote unquote pneumonia virus or whatever it is, bacteria rather, for pneumonia. So that is not what has been happening with the coronavirus. And we have been talking about, a lot of people are getting these PCR tests that say, oh, you have COVID, and they have been completely asymptomatic, meaning the only reason why they had this test done was because they were required to do so because of work or because they were freaking out or something like that, not because they were exhibiting any kind of symptoms. So, Dr. Huante, I would love for you to talk to us a little bit about the difference between being infected, or should I say being exposed to a virus, versus being infectious.
Well, when we get in contact with a virus, we can say we are infected because we're having an immunity response inside our body. But there are two scenarios. Scenario number one, we do develop symptoms and signs, and we have all the COVID symptoms, like the classic COVID, the flu, the sneezing, the fever. And a second scenario would be asymptomatic. That means no symptoms, no signs, no fever, no anything. But you still have the virus, you still have a contact with the virus. Your immunity cells are working, fighting up against this virus, even if you have or don't have the symptoms. And you can infect other people, if either you have symptoms or not. Okay, so yes, you are infected because your immune system is working against it, and you can infect other people. Okay, so that's important, that even though we don't have symptoms or we are not symptomatic, we can infect other people. As long as with the vaccines, with the shot, you can still infect other people if you have the vaccine shot and you get in contact with the virus.
You know, that's a really important point, Dr. Huante, that many people don't realize, that people who are vaccinated are actually carriers of the virus, ironically. So what I share with people is, you know, when we're talking about this whole silly nonsense between vaccinated, unvaccinated, I say, look, I should be afraid of the vaccinated people, not vice versa. Meaning, if you have this vaccine, supposedly you believe that this is giving you superpowers and this is protecting you. So if that be the case, you should not be concerned about me, who is unvaccinated. Yes, I'm unvaccinated. I will never, ever, ever be unvaccinated. But anyway, that's another issue. The flip side is that if you have been vaccinated, you are a super spreader. Okay, you've got this stuff, then you can infect other people. So remember this, okay? That's the irony. Now we have a question that came in, and the question was, what kind of foods or herbs or homeopathic remedies can you have to fight bacterial infections and viral infections? I'm going to throw that to Dr. Huante first.
Sure. Well, to have a good immunity system, it's important that we have vitamin C. And of course, it's always better from in the natural way. That means from lemons, all the citric fruits. So vitamin C, vitamin D, it's also very important to keep our immunity system healthy, and also zinc. So eating fruits and vegetables and seeds and nuts, it's very important to keep a healthy immune system or to keep a healthy body, okay? And talking about homeopathy, there's not really a specific homeopathic remedy to take, because in homeopathy, you only treat the symptoms. So once you have one symptom, you get to your homeopath doctor and we will refer a specific remedy to those symptoms you have, because even though we can say, yes, there are COVID symptoms, but some people have fever, some people don't, some people have diarrhea, some people don't. So we focus on the symptoms that every person has. So it's an individualized treatment. Mm-hmm. And so that's the way the homeopathy works, and that's the way we should treat it, with the symptoms that every person has. Okay, so that's about homeopathy.
Awesome, awesome. So as I had mentioned before, you have things like the quercetin. Also, echinacea is a phenomenal herb for viral challenges, let's put it that way. Then you have a variety of different essential oils like clove. Oh my gosh, clove is a very powerful, powerful essential oil when it comes to fighting bacterial infections and things of that nature. Also, things like all of the essential oils that are coming, as Dr. Huante said, from the citrus type of family. So your lemons, your lemon essential oil, as well as the lemon, the fruit. And the lemon essential oil has what's called limonene in it, which is like a concentrated solution coming from the rind of the lemon. And then you have other ones will be such as, it flitted out of my mind for a second there. But anyway, the ones that are coming from the citrus family that will have a limonene component, and that's very tremendous in terms of helping to boost your immune system. Now, in terms of whether or not it is as strong as the medications such as ivermectin, hydroxychloroquine, no. Mother Nature is not as, how can I put it, intense when it comes to helping your body, because Mother Nature works more in the realm of subtlety. Now, if you want to have the cannon come out, that is when you get to the point of ivermectin, hydroxychloroquine, and then for things like the respiratory system, the budesonide and things of that nature. So it's always looking at things on a continuum, right? So we start with foods, going back to the food thing. So with foods, you have things like garlic. Garlic is phenomenal for boosting your immune system, right? So you have foods. And then what's more concentrated in foods? Herbs, right? So that's where you get things like the echinacea tincture and things of that nature. And then after herbs, you have even, say, your essential oils, which are more concentrated than the herbs. And then after you have Mother Nature's wonderful medicine cabinet, then you get graduated, unfortunately, into the medications. So the medications are much more concentrated and they have a lot of side effects. Please keep in mind, every single medication ever created by man has side effects. Do not believe Michelle Gamble. Please look at your inserts. Yes, take out your little Walmart reading glasses if you have to, and read the inserts. When you listen to these wonderful commercials on the TV, Listen to when they go, may cause, they kind of rush through that while they're showing you the pictures of people jumping and leaping in the air and happy and everything of that nature, and may cause death. Yay! Yay! So you're being distracted by these wonderful images of wonderful people enjoying life as you're being told it may kill you. Okay, so do not believe Michelle. Look at the inserts because they are required to put this down. And now, even when we go back to the COVID vaccine, may cause death. Yes, may cause death, may cause things like myocarditis in our children. Yes, our children who have practically zero possibility of dying from the actual COVID virus are having a significant horrific outcomes with this particular shot. So many of our kids are ending up with their lives taken away. And these are our healthy children. See, that's the difference between the virus versus the shot. The virus takes out the weakest of our children. And people don't like to hear me, they don't like to hear me say this, but that's what it does. So it's the children who have been suffering with various forms of immune compromise, whether it be cancer or some other illness. Out of the 18 months of being exposed to the coronavirus adventure, let's put it that way, approximately 350 children, not 350,000, 350 children have died, regrettably. And that is very, very sad. I completely have sadness in my heart for any family member who has had to deal with the passing of a child. That is just probably one of the most horrific experiences to have. And at the same time, we have to put this into context because now in the VAERS report, which is the Vaccine Adverse Reaction, Adverse Event Reporting System, that is from the CDC, once again, they are acknowledging hundreds of children who are encountering what's called myocarditis, inflammation of the heart. And these are your strong, athletic children, and you've probably seen, well, you may not have seen because of all the censorship, videos of some of these children who are like athletes, dancers, football players, things of that nature. That is gone for them because they have had myocarditis. And there's no such thing as a little myocarditis. No, that is inflammation of the heart. And that is something that will weaken them for the rest of their lives. So when we look at medications, there are always side effects. Please understand this. And it is your responsibility, okay? I'm not going to put it on the doctor, okay? I'm here to make sure that you take charge of your health. It is your responsibility to find out what the side effects are, what the possible side effects are, so that when those side effects occur, and they will occur, it's just a matter of time, and it's just a matter of which ones, when they do occur, it is your responsibility to report those adverse events to the VAERS system, to your doctor, so that there's a record of this. So please be on your very, very best diligence when it comes to things like that. Dr. Huante, are there anything that you would suggest to people with regards to that?
No, yes, they are responsible for their health, as you said. And yes, part of this is being responsible of what you take, what kind of treatment you decide to have, if you decide to have the vaccine or not, and all the reactions that you may have due to the vaccine or to the medications or to the treatment that you choose to have. And yes, also always tell your doctor about any reaction, even though it's mild reaction, because this will make like a realistic statistic of what's going on in the world.
Yeah. And please know that, again, it is your right to have these events reported. And if you are having difficulty with getting your medical doctor to do the reporting for you, please reach out either to me or you can reach out to places like childrenhealthdefense.org, and they have qualified professionals that will help you with the reporting of any adverse events. And for all of you in this call, please share this information with everyone that you come into contact with. It is very important that we get on the record any kind of adverse events, not only for COVID shots, but for all medications, because it is very, very critical in the development of the medication. Now, granted, I'm not really a medication kind of chick, but I do understand that the only way that we can get better medications is if we have thorough reporting. And unfortunately, many people are being dissuaded from reporting these adverse events. Many people are being told, oh, it's just a normal reaction, no problem. No. If it's a reaction, that is God Almighty telling you through your body something is not okay. And so it's very important that you pay attention and that you honor your body when it's talking to you so that you can get the help that you need. Let's see, I think we had another question. So they were saying, if you take quercetin, will it protect as well as ivermectin or hydroxychloroquine? So now the quercetin is an actual natural herb, natural food source. You know, it comes from the citrus family, right? However, when you're talking about medications, medications have to be prescribed by a medical doctor, and those medications would have to be taken in accordance with whatever the medical doctor is stating. So the quercetin is more of a everyday kind of build your immune system kind of thing, right? Because your body actually utilizes quercetin. You know, your body actually utilizes vitamin C. Your body actually utilizes vitamin D. It's a component of natural eatery for your food. Ivermectin is not natural eatery for your body. Your body's not ivermectin deficient. Your body's not hydroxychloroquine deficient, right? So those medications are more to be utilized if you are in a certain risk category, number one. If you feel that you're going to be exposed, number two, then you would go and speak with your doctor and ask your doctor about the advisability of taking it in a prophylactic kind of manner. And he or she would give you more indications as to how it's applicable in your situation, or maybe it isn't, you know. But quercetin, anybody can take it, you know. Well, I won't say anybody. There are always certain people who are allergic to everything. Like my daughter's allergic to strawberries, right? So again, listen to your body. Don't listen to Michelle Gamble. Listen to your body, you know. So we have to, again, like I said, look at it at a gradient, you know, in terms of food, then herbs, then tinctures, then essential oils. You know, that's the intensity. And actually, even before food, you have homeopathic remedies, because the homeopathic remedies are so subtle that it's just amazing, the power of homeopathic remedies in terms of how they work in the body. So foods are actually, in a way of speaking, more macro than homeopathic remedies, because with a why am I saying anything? Dr. Huante, help me out on this one.
Well, that's because homeopathic remedies are energy. They don't have like any material. There's not like arnica leaf or a little piece of leaf. No, it's just the energy of the flowers, of the plants. So that's why that's very subtle in our bodies, and it starts working from within with our own energy to be in balance, and that way we're going to recover our health. So yes, that's maybe why you said it's before food, because food is like material. We can touch it, we can have it, and the other, it's energy.
Yeah. So to answer the question, I wouldn't even compare them, meaning I wouldn't compare quercetin with ivermectin, because they're just very different. And ivermectin is for much more intense kind of intervention. What I have suggested in previous versions of The Doctors Are In is for you to contact one of those agencies that we were talking about and have a conversation with them so that you can determine whether or not, with their assistance, whether or not it's something that you need to have as a preventative, what we call prophylaxis. So there are certain people that are taking ivermectin and hydroxychloroquine as a preventative measure. So they're taking like once a week or once a month or whatever it is. But that is something that needs to be done in concert with, in agreement with a medical practitioner who can monitor this intervention and give you much better insight into how to actually utilize those things if they're needed. And I think at this point in time, they're really limiting that kind of intervention to people who are in the high risk categories. So people who are more older or who have cardiovascular issues or diabetes or obesity or things of that nature. So that's why you've seen in previous shows, we've had some of the participants have said that they have gotten hydroxychloroquine or ivermectin and that they're taking it on a continuous basis as a preventative measure. But that was done in concert with a medical practitioner who is able to administer that kind of prescription. Okay, any other questions? No other questions? Wow, all righty. Well, ladies and gents, I want to thank you so very much for joining us. And yes, we have talked a lot about COVID, but please, please, please do your research. Yes. Oh, question. Yeah.
I'm sorry. Well, not a question. I just want to say thank you all so much. This information was transformational for me. Oh, by the way, my name is Pastor Kamaya Dickerson. It's my first time. I love you, Dr. Gamble, and just to hear the other doctors and the testimony. I don't know if she's still on, but you really blessed me because I believe the hospital killed my father-in-law as well. So you blessed me. That brought confirmation to how we have.
We lost you, Pastor Kamaya. I don't know what happened to the volume. So, ladies and gents, the biggest thing that we want to share here is please, please take charge of your health. And if you are blessed to be an advocate for someone, know that it is your divine responsibility to advocate for that person. Do not allow medical practitioners, do not allow teachers, do not allow politicians to bully you into not being able to advocate for yourself and for your loved ones. It is your right. Not just yesterday, but today. It is your right, your God-given right, not a constitutional right, not a Democrat, Republican right. It is your God-given right to advocate for stewardship of your body. And if you have the responsibility of someone else in your family, then it is your divine right again to advocate for that person. I believe that as a mother, it is my divine right and responsibility to advocate for my children. And I will continue to do that till the day I die. It doesn't matter who's president. It doesn't matter who is saying what. That is what we fight for. And I encourage you to bring forth that divine steward within you and advocate for the ones that you love, especially in this crazy world that we're living in right now. Please do not allow people to bully you. Please do not allow people to intimidate you. Know that together, community creates immunity, not just natural immunity, divinely orchestrated immunity that can help us to heal and build strong, beautiful people, young and old.
I'm sorry, can you hear me now, Dr. Gamble?
Yes, we can. Go ahead, Pastor
Okay,
Kamaya.
again, I just want to say thank you for that testimony. And I also want to give a quick testimony as well. My mother-in-law, well, actually, my sister-in-law had to go in the hospital, and she went in there for blood treatment, supposed blood treatment. Then she was in there for a couple of days, but then they came and said, "Oh, you tested positive for COVID." The testimony is that I'm about to call my grandma, my mother-in-law, she had enough sense to know, no, y'all ain't about to they were about to transfer her to the COVID floor. My mother-in-law said, no, y'all ain't about to put my baby on the floor. She told her to get her, you know what up, I can't say the words, and we're getting out of here right now. And she took my sister out of the hospital, took her home, nurtured her the right way. She is now up and moving. And guess what happened, y'all? That so-called test that said she was supposed to go to the COVID floor, it was actually negative.
Wow.
It really wasn't, and what we learned tonight, the test it's no hill of beans anyway, don't mean nothing. But what they was trying to say, she had COVID, and now the test is negative. So this is proof of the power of what you all are doing. I'm so happy that people like you all are alive and that it's on this earth, because the evil that is happening in this world is almost unexplainable. So I just want to say thank y'all again, and I love y'all so much. Appreciate y'all.
Yay. Thank you. Remember, please be aware and please do the research. You know, I know Dr. Huante will agree with me when we say that the best person to have for her as her patient and for me as my client is someone who is inquisitive and curious and cares so much about their health that they bring information to us. I learn all the time from my clients. They'll come to me like, Michelle, did you know about this? Did you know about this? Did you know about this? And I'm the kind of person like, wow, new information, yay. So I encourage you to challenge your health practitioners, challenge your doctors, challenge your nurses, challenge your dentists, challenge all of us, because that is how we grow and that is how you stay in charge of your health so that you can create a happier, healthier you. Thank you so much for joining us this evening. And thank you, Dr. Huante. I'm very happy to know that the earthquake did not gobble you up.
Thank you. I love to be here. Thank you, Michelle.
Yay. And I guess something came up with Dr. Laing and Dr. Sutton. I know Dr. Sutton was eager about being here tonight, so I have to make sure I check in with her. And I encourage all of you to reach out to Dr. Sutton. She is in the middle of court battles because they are trying to remove her medical license because she did the horrible, despicable thing of writing medical exemptions for children who had serious issues with vaccines. How could she ever do such a horrible thing, right? But anyway, let me not get on my soapbox about that one. So again, thank you, everyone. And we will see you next month. Invite everyone and anyone that you can and bring some questions, you guys. We need some hard-hitting questions so that all of us can grow and all of us can become healthier. Thank you, everyone. Mwah.
Thank you. Good night.
Good night. Bye-bye.